Hello, welcome to Judy Manages MS. You are at my channel that is all about my journey with multiple sclerosis over 25 years. And as you will see, I have my friend Chris. She has only had MS for a few years, but we are going to visit with you today the challenges of diagnosing MS. Chris, I have experienced different kinds of symptoms even now than you do. And I think other people probably have a multitude of symptoms.
I took myself off to my PCP and I mentioned to him that I was feeling aches and pains. My legs were numb. At the front of my shins, they felt tingly. I was getting tingles in the tops of my thighs every time I run. I was a runner. And when I ran, I would also get this blurriness in my right eye. And what did my doctor say to me? To the 48-year-old woman that was reporting this? Well, that's probably perimenopause there, Chris. I have a stressful job. I was a director
Don't
of a
we
school.
all? Right.
Exactly. So maybe, you need to de-stress a little bit. And maybe you need a little something to manage your anxiousness. So the antidepressants were mentioned.
No, none of that was ever talked about for me. No, I just
So
never could find the right doctor. I decided that the pain that I felt in my hips and my body in general were there for the rest of my life and just get over it.
yeah, it's an age thing. It's a woman thing.
That's right.
It's the change of life. They call this medical gaslighting because that it's a reasonable thing to suggest in a normal person. But when those things don't seem to get any better and they consistently get worse, then there's something underlying there. And that's when you had physical symptoms that kind of
When I finally was sent to a neurologist, he watched me walk into the office, and I could tell. He said, "I think I know what is going on, but we need to do an MRI." And you had an MRI too. I think that is pretty standard for the beginning.
I was given the MRIs, one of the brain, one of the thorax, and one of the cervical spine with contrast. Those came back with lesions in all three.
The evoke potential runs tests on every one of the senses. That's what it does. And fortunately, the ocular nerve, is the one that he could see the disruption to the brain. Well, then what happened after you got your diagnosis?
But automatically, they gave me the steroids for 3 days to kind of calm down all the inflammation, the pain that I was feeling. And the disease modification therapies were discussed. Judy's experience was very different 25 years ago.
25 years ago, the only drugs available were the ABC drugs, and they were all injectables. I had to learn how to give myself the shot. I mean, in the beginning, they didn't even have pre-filled syringes.
Oh, no.
Apparently, a lot of people don't do needles, so it's a good thing that there are now oral drugs. Well, I'm off of all medications too, but it took me quite a bit longer, Chris. I've been off of the drug for 6 months, not long. Drugs are important. MS is very challenging to diagnose. Everybody has different symptoms. Symptoms really mimic
a lot of other things.
Advocate
for yourself. You're the best person to know your own body.
That will do it for today. Come back next time. Thank you, Chris, for joining me.
Thanks, Judy.